here. All right, my name is Jenny Mays. I'm a family nurse practitioner and I work at the University of St. Francis. You guys have kind of worked your way through all the stations so far and kind of gathered everything that you need, done your assessments. And as you well know, when you see patients, when we treat patients, you know, we're working together as a team of professionals to provide really comprehensive care. And then it becomes our job to be able to communicate that plan and those expectations for patients and families to them before they go. So what we're gonna do in this station is we will have one of you guys, I think, do I have a couple PAs? I don't think I have an NP in this one. Okay. Yeah, all right. So we're gonna have one of you lead off the conversation about the discharge information. For the rest of you, you're welcome to chime in to add information, or if you want clarification, just let us know. But I will let you take off and lead that conversation, okay?
Hi, my name's Kayla. I'm a physician assistant student, just getting your guys' discharge notes ready. And your name is Braxton, correct?
Bradley.
Bradley, so sorry. And are you a family member?
Grandma.
Oh, hi,
His
Grandma.
favorite grandma.
Oh, of
Yeah.
course. So can you tell me what your understanding for your condition of why you kind of had to be admitted to the hospital?
I was just playing football as I usually do. Next thing you know, I was at the bottom of a dog pile and then didn't come up with everyone else. And then I woke up in the ER.
And did they talk about any of your like EKG findings with you or your okay.
Not necessarily.
So the medication Celexa that you have been on for a little bit, it carries a risk where it's called prolonged QT syndrome, and what it can do is your heart, when it contracts, it has a recovery phase after, and that whole time frame essentially is too long for the conduction through the heart, which essentially led to your event and got you here.
Is that are you just talking like heart pumping?
Yes,
Okay.
so basically the time of the conduction through the heart was just a little too long, and that was shown on your EKG findings as well. So because the Celexa is what we believe to have caused that, we're gonna taper that down. So what we're gonna do is decrease the dose kind of slowly so that, to avoid the risk of withdrawal since you are on one of the higher doses. And then we're gonna,
which pill that is, so we
The
don't take it by mistake.
yeah, with the Celexa or whatever it's called.
yes, and we can send you home with
Yeah.
like
What
all
color is it?
instructions and everything.
I do by
for it.
colors, what color would that pill be?
It's the only pill that I want.
It's usually like
Okay.
a reddish. Okay.
Oh, okay, like an Advil.
Yeah.
Yeah, okay.
Yeah, it's the same color.
So in
So if I
that,
swap them out, they'll never know.
Maybe you take the ones that have your name on it.
so after we taper your Celexa down, we're then gonna transition you to a different medication in the same drug class, called paroxetine. This one doesn't carries a much lower risk of causing that prolonged QT syndrome. We don't wanna take them at the same time because there are risks of the two medications interacting with each other. So we will start that one once we taper it down. Similar side effects to the medication that you were on to begin with. So you might notice you could have GI upset with it. You could have sometimes some people report experiencing a little bit of like anxiety symptoms. You could have decreased sex drive. I'm not
GI,
sure.
is that like, what's that?
You could have like a little bit of nausea. You
Okay.
might have like some constipation, but not everyone reports those, so potential. And then there is also, I want you to, when you are tapering down and then when you go to start on this new one, if you notice any worsening feelings of depression or like thoughts of hurting yourself or others, I want you to either call immediately to your primary care and go in or go to the ER, but either way we want to make sure that you get taken care of.
Is that just the two meds interacting with each other?
No,
or-
so that's just a risk of any antidepressant when you start them. Sometimes how it was described to me in school is that sometimes people when they're more depressed, they might not even have the motivation to carry out certain thoughts, but then once they get their antidepressant, they might have more of the motivation, and so they're at risk of suicide. If that is something that you struggle with, then we might not want to jump right to starting that medication. And on the ADHD meds, because of the prolonged QT syndrome, you're at a risk of going into an abnormal heart rhythm. And so your ADHD meds, since they're a stimulant along with increased caffeine intake, we want to hold that. I know caffeine, so as best as you can, try to hold that, and then we're gonna hold the ADHD meds.
What if my like daily diet is caffeine so that I can function?
Well, if you are think that you have more of an addiction to it, then we definitely don't want to completely take you off of it. So if we can just try to like decrease the amount as best as possible, but still don't send you into withdrawal symptoms like headache and all that. But we just don't want to put you at a higher risk of going into one of the abnormal heart rhythms and then coming back, having to come back to the hospital. Oh yes, and then so as far as sports go, we're gonna have you follow up with cardiology in a week since you're gonna come off or start tapering down on the Celexa. We wanna make sure that that QT interval of your heart kind of comes back within the range that we like it in. And then at that time, they might clear you to go back to playing sports if everything looks okay.
Can I still work out while waiting to play football again?
I would say no physical exertion for the next week until you go to the follow-up and can get a follow-up EKG to make sure.
Okay.
I thought we'd go to Florida.
Yeah, we were thinking about going to Florida after this.
Well, I thought we could leave just soon.
Yeah.
I'm packed, are you?
Yeah, I am.
Did you get insurance on the plane ticket?
Oh, we're driving.
I think it's
That's
probably.
why we're gonna have McDonald's frappes to keep our energy level up.
If there is a way for you guys to be able to maybe postpone that for a week so you can see the cardiologist, I would feel more safe
That doesn't
if you
work
could
for
get
me,
that
does it for
clearance.
you?
That's your call.
Well, we need to go.
Okay.
So I think being in the sunshine, walking the beach and would be better for him than all this. That's where my one Advil a day comes in.
Do you have any providers in Florida? Do you go to Florida frequently?
That's a mom question.
Cause the only thing is I don't know if you'd be able to follow up in a week with somebody in Florida, and that follow-up's super important. So I think it'd probably be best if you stayed, given the recent hospital admission as well.
I think we might miss it.
Sorry, Grandma.
You tell your mom we're
Okay.
finding someone.
Okay.
You wouldn't tell, would you?
I might. I think that's it. Do you have
It's
any?
for his own good.
Yes, for your own good. I just think Florida would be. I heard the weather in Florida is gonna be a lot better next week.
See how you manipulate that? I like that. I like that a
The
lot.
weather. It was rainy on the forecast.
Maybe we
this
should take the recommendation. We'll save it
Yes.
Oh,
for a
well.
week.
Yes. But we do just want to make sure that the syndrome was all due to the medication and that you don't have a prolonged QT of your own that we need to be careful about. So, do you have any questions?
I don't think so. So it's just a week that I can't play football.
As long as your cardiologist at the follow-up, everything looks good, then yes, but that will be
Okay.
determined at that time. Yep.
And then when will the medication switch start? Does that just start today?
So what we're gonna do, we'll write down instructions for tapering it down. They're gonna, speaking with the pharmacist, they recommended tapering down, so your current milligram will kind of go down by 10 milligrams, and we'll do that in 2-week intervals, to see how you handle it, and then at that time, then we'll transition you to the other medication that we had discussed.
Good job. Good. Does anybody else have concerns? They were way too nice. So sometimes you're gonna get a mom or a dad that's really aggressive, right? And I've had this in clinical before. They get in there and they're in your face and they're like, man, I've spent thousands of dollars on his training. I've got, someone coming out to check him out next weekend. I need him to be out on the field. I look at your EKG and you're telling me it's normal and we're gonna hold his caffeine. If we're changing the meds, if his EKG is normal, why can't we get him back out there on the field? Right? How do we navigate that?
I would probably explain the risk of the arrhythmias that he could go into and how those could result in death, and that even though right now it does look okay, it's not worth the risk of him going back into that.
Yeah, absolutely. Just the risk, right? this has happened, it could happen again, we got him up, he's going, but what happens if we can't the next time? You know, we're lucky this time, do we play with fate twice? You know, we've got a washout period, so we're gonna have a little bit of time with this med transition, you know, that he could still be at risk for some of these things, and so we need to take that break and have him reevaluated with cardiology. Like I said, most of the time now that we've seen a professional athlete drop, you know, on live TV, we don't have too many parents now that fight about it. Now they understand the seriousness of it, but before it was a little bit weird sometimes because they were really aggressive about getting that kid on the field. And you know, they may be upset, but they learn. You talk them down and we figure it out one step at a time. All right? Yeah, good job. I really don't have anything else here. You guys hit everything spot on. Great job, by the way. And if you guys don't have anything else to add, I will not continue to just string time out. So you guys are good. What we'll do next, you guys, if you need a restroom break, you can have it. And the next group or the next room will be your debriefing room. So we'll get you guys wrapped up and